Marcelo Hochman here to talk about a new surgery that is out for people who suffer with migraines. Thanks so much for being here.
Thanks for having me.
So migraines are horrible. A lot of people suffer from them. I myself suffer from them, and I know what it's like to just feel almost like you're not human because you're in so much pain. Can you tell us the difference between someone who's suffering from a headache and someone who's suffering from an actual migraine?
Sure. There are over 150 something types of headaches, migraines of which is a very specific type. So it's important that we have the right diagnosis. So that's part of the workup as to who's eligible for these treatments or not. Medicines are always part of the protocol, but now we have some options that include surgical and some non-surgical things, but that are complementary to the medical therapy.
Okay, and can you tell us about the surgery and who is eligible to have that? How do they know that they actually have the type of headache that is necessary?
So first we need to make sure that it is a migraine headache, so that diagnosis has to be confirmed. Two, there are places outside of the brain that we operate on. It's outpatient surgery. It is relatively non-invasive, so some of it is endoscopic, and some of them are just treatments in the office that address areas outside of the brain, which is where the medicines work, that still decrease the input to the areas that are abnormal inside the brain. So it's just a different approach that's complementary to what people are on already.
Well, great. Thank you so much for letting us know. I know anyone who suffers from a migraine like myself understands that it's hard to not even be able to go about your day-to-day life because you're in so much pain.
Right.
And
So if you go to the website, there's actually information about all the procedures, and then there's a questionnaire that kind of sort of sees whether you're in that group of people who might benefit, and then of course we'd be happy to see them in the office and then work with their neurologist to see if this is right for them.
Fantastic. Thank you so much for being here. And again, if you'd like more information, you can go to surgeryformigraines.com or call the number on your screen.
Preparing for Christmas in September? Say what?